Ladies and gentlemen, imagine a silent predator lurking among us, striking billions worldwide, causing illnesses, hospitalizations, and even death. Yep, that predator is none other than influenza, a virus that mutates constantly, challenging our defenses and requiring annual vaccinations to keep it at bay. Don't worry, it's not that alarming. Let's dive into something that's not all about sniffles and sneezes, but a vital defense against them, the influenza vaccine. So, according to CDC, annual vaccination has emerged as a key preventive strategy due to its exceptional efficacy in preventing severe disease manifestations. Despite widespread availability of these vaccines, there still exists a shadow of doubt among many, fueled by myths and misinformation, posing a significant threat to public health. So the question here is why? And to answer this, considering the future prospects, we worked on identifying the awareness, attitudes, and the determinants of influenza vaccine acceptance by exploring demographics, influenza-related experiences, concerns about the vaccines, and the willingness to vaccinate via a cross-sectional study. And of 176 participants, 54.5% were vaccine hesitant, whereas the remaining 45.5% were not. So, further logistic regression analysis gave us key findings highlighting the factors that influence vaccine acceptance. The first one being a healthcare worker. So, this is consistent with scientific evidence by the Malaysian Society of Infectious Diseases and Chemotherapy, referring to this community as a high risk group requiring annual vaccination. So, this could be one reason why this community is more acceptant of vaccines. Next, under individual and group influences, previous influenza experience, personal risk perception, and the recommendations from close contacts such as family, classmates, and friends, and the trust in medical personnel significantly influence vaccination decisions and highlight the importance of social influence in vaccination behavior. These are all consistent with studies done by Zhu et al. And Ibrahimi OV. Lastly, the lack of knowledge or the misconceptions about influenza and the vaccine also affect the risk perception and vaccine acceptance. So, in conclusion, we have found that the intention of individuals in the non-healthcare sector to receive the vaccine was low. So, this research underscores the complex interplay of factors influencing vaccine acceptance, crucial for informing strategies to mitigate the impact of influenza by improving vaccination uptake and public health outcomes. So, remember, when it comes to influenza, knowledge and vaccination are your best allies. Imagine a world where influenza no longer threatens lives, where we collectively build immunity through a protective shield woven by science and solidarity, namely influenza vaccination. I would like to end with the tagline quoted by the Queensland Health Group: "Spend 5 minutes now and spare 5 days later." Thank you.